Okay, so for a sports massage routine, this is a post event routine that we're going to do. In terms of pre-event routine, we can just follow the same structure from this and just utilize the move in a faster manner. In terms of giving out instruction, we are going to do the post-event routine. So what we're going to do is start the athlete in a supine position and start the athlete at the face up and at the head of the table right there. Just make sure they're not dangling off, they're comfortable, and we can put a bolster underneath their knees just for comfort, especially for those who have back pain problems. Yes, you. Okay, so the first thing we're going to do is the pec minor compression. So we bring the arms out into a 90 degrees and we can use our palm to right along the interior deltoid and right at the pec. We're compressing the pec minor and just nice and soft touch going in. Gradually increase the force. Do this a couple times. I like to add in a little bit of pin and stretch where I pin down the pecs and go external rotation, coming back out, and do that a couple times. So notice I am in a lunge position along the table where I can gradually increase the force by lunging forward and coming back, forward and coming back. And then next thing we have is bicep compressions. So we are using our thenar eminence, pressing along the deltoid, going down to the biceps and coming back up. We'll repeat this 3 to 5 times. From there on, we are going to work on the triceps. So I can grab her wrist right here, use my other hand, open up the palm, and support her elbow coming back. She's a little tight here, so we'll take our time, gently place them, and we can do compression on the triceps from here. What I like to do is utilize my hand to support right here, right by the hips, and press and stretch, press and stretch. Do that a couple times. Another technique we can do is come to the side and clasp our hands, compress and stretch, compress and stretch. Something I like to add is compression along the sides so I can support the triceps, press the lateral line all the way down to the hips, and a little bit tractions for the low back. Okay, so moving forward, we are going to have the shoulder stretches. I like to do a little bit of traction down, coming out 90 degrees, a little bit of traction, bring it back out, a little bit of traction, and I like to add in a crossbody as a transition, a little bit of gripping the shoulders and pull, compression along the side. We can go towards the erector spinae. This feels wonderful and it's great to provide a little bit of compression along the thoracic spine. And pretty much we're now set up to work on the other side, and pretty much repeat the routine from there. So for the lower body, I like to kind of take out the holster because I am about to do some additional stretching, and my style of application is a little bit towards Thai massage, where it depends on the setting. If it's a post event at my clinic, I can work on the feet a little bit. Where we are in an event, they might be wearing shoes, and I might skip this step. So if we're in our clinic, I would normally do a little bit of compression, open up their legs laterally. That way it shifts their hips a little bit, and we can go internal rotation as well. There's a nice gentle press that helps loosen up the hips a little bit. From that point on, we can start providing compression from distal to proximal. So what I'm doing with the shins, because the shin bone rides along here, I'm doing a butterfly stance with the hands and just kind of pressing down from medial to lateral, both sides. Do that a couple times. And then I would come up to the kneecap in small circles about 10 times, and then oscillating the reverse for about 5 to 10 times, and then continue with the butterfly palm press up to the hips and back. And I would repeat that a couple times. And we can do a little bit of effleurage just to get the blood flow going. From distal to proximal is where you put in a little bit extra force and come back softly. And then from that point on, we can bring the leg up. I'm going to have a seat on the table, anchoring down her ankle. And we are going to do compression along the shin, compressing the gastroc laterally. So medial to lateral, distal to proximal. So I'm pulling out this way, and then I'm going to compress down from lateral to medial along the calves. Do that a couple times. We can do a little bit of friction. Just going in and out. Warm up the tissue. And we can do a little bit of traction from the thighs. So right here, this is a great little low back stretch. Just hold it for a second or two before you let go. This is one great way to provide some relief on the low back. Moving forward from there, we can do a cradle with our forearms to anchor their legs, and our other hand controls their knees so that they're nice and secure. And we can go a little bit circles. Little hip circles are great to open up the hips. Do about 5 to 10, and then I'll reverse for 5 to 10. From there, I'm going to transition out. So my hand is still supporting the knee. What I'm doing is sliding down and support the bottom of the knee so she's not hyperextending as I come out of that position. And then I can hold her ankle, do a little bit of traction right there, and transition. Placing her ankle right by my hips into a lunge stance. And I just lunge forward to do a adductor stretch. She's quite flexible. So what I can do is anchor her legs on the other side, go forward a little bit more and nice and control. Lunge forward for a better stretch. And I can also bend her knees at 90 degrees, anchor at my hips. Same thing. Now I'm going to use this arm, control right here on the knees, and press forward. That might get her a little bit of better stretch from there. So from here I can transition into bent knees. So my forearm is going to be the one pressing on the hamstrings. 2, 3, distal to proximal hips. And then from there, we can do cross body. So what I can do is place her ankle right by her opposite knee. And then I'm going to guide the knee cross body to give her a hip stretch from there. Another way I can utilize this, if this is nice and secure, I can switch my hands. Now this is the pushing leg. And I can anchor down her hips just in case she rolls over. So I gently press down right at the hip and gently press cross body with my other arm. So this is a lighter stretch. From there, I transition back. So bring her into a figure 4. And if I want a little bit extra force, I can cross my arm through, thread the needles. And what I'm doing is just gently push with this arm and pull with the other. So just a little turn. And this is great piriformis stretch from there. Something I can transition into, same idea, but I'm bringing her other leg up. I'm pushing forward with my right arm and the left arm pull. And that's another great stretch from there. Okay. From there, I can transition cross body. So now my hand anchors at her knees. Gently bring her legs cross body. I can anchor it right by my hips. And this arm I can grab at the low back level and pull to provide a little bit of a stretch. So, right here. She's super flexible. Okay, so pretty much I'm anchoring down, pushing her from lateral to medial with the outside hand, inside hand, gripping at the hip, right around the TFL and low back, and pull. Now, because she's quite flexible, I can switch my positioning. So, bring you here first. So from here, I can come to the other side and anchor this way and push down. Or I can bring my leg, block her from turning towards me, and stretch this way. Okay, and I can always secure her leg right on my hips and utilize both arms to pull and sit back. See how she's turning, lifting up? Another trick I can do is have her anchor right by my hips, support the hips. My outside arm can push down on the pec as I sit. That prevents her from dropping towards me. Okay. And then from that point, I can do a little bit of traction
Please pull it. I feel like it feels so good.
And then reset from right there.